CVS and Walgreens changed their policies on giving COVID vaccines.
Sabrina Wilson spoke with people in our area who say they're concerned.
Americans have been able to easily get the COVID-19 vaccine at major pharmacies, but recently CVS and Walgreens made headlines over what will happen in at least the near term, and some people are worried.
I'm not for it, and hopefully we can kind of come to some kind of compromise, but a lot of things are in the mix, under balance with that.
CVS tells me pharmacy laws govern where it can currently vaccinate and says right now, dependent on state law, it can offer the updated COVID-19 vaccines to patients depending on their age prior to the Advisory Committee on Immunization Practices, known as ACIP, if they present an authorized prescriber's prescription. Here's a map of the states CVS says where prescriptions will be required, and Louisiana is on it. In its statement, Walgreens says it is prepared to offer the vaccine in states where, quote, we're able to do so.
When you take away, for example, a free shot at a Walgreens drive-through, which is what I got, you're making it that person has to go another level of paperwork, another level of administration, and there's always going to be a cost involved with that.
There are a lot of needless expenses that we incur in healthcare. And this could be an example of one of those where the government has inflicted an additional cost on people that like to get the vaccine. Walgreens and CVS have decided to play it safe.
Over the years, ACIP has made recommendations on vaccines to assure the public knows they are safe and effective. But earlier this year, HHS Chief RFK Jr., a known vaccine skeptic, fired the panel's members and appointed his own. And last week, the CDC's director was fired and some other high-level staffers resigned. ACIP's next meeting was scheduled for this month, but U.S. Senator Bill Cassidy of Louisiana, who is a medical doctor, calls for the meeting to be postponed. He wrote that if the meeting proceeds, any recommendations made should be rejected as lacking legitimacy given the seriousness of the allegations and the current turmoil in CDC leadership.
And I think that, Cassidy is wise here. And the idea behind it was to expand people's access to vaccines. No longer would they have to go to the doctor's office to get them. Rather, they could go to the pharmacist, and anything that they were recommended to get by the ACIP, they would be able to get at the pharmacist.
And there are concerns that the prescription requirement by certain pharmacies will heavily impact people who don't have primary care physicians or health insurance.
I kind of, oppose that.
So I think that this barrier is going to fall really unequally on people that are less able to access the healthcare system.
I reached out to the Louisiana Department of Health for comment today for this story, but so far haven't heard back. John.
Thanks, Sabrina. New Orleans police say that a man